Hello everyone, I welcome you to this lesson where we are looking at poliomyelitis. It's one of the infectious conditions. Okay, poliomyelitis. Myelin sheets to do with nerves. So poliomyelitis, itis inflammation. So this is a combination of three words: polio from the disease causing agents, and then myelin sheet to do with the nerves, the itis, and then inflammation. So we're looking at poliomyelitis. At the end of the lecture, students should be able to gain knowledge and understanding of poliomyelitis and its management. The specific objectives for this lesson is that at the end of the lecture, students should be able to define poliomyelitis, outline the etiology for poliomyelitis, state the incubation period of poliomyelitis, outline the risk factors for poliomyelitis. Okay, so those are the specific objectives. But otherwise, other things still that we are going to ensure that you are capable. After this lesson, you should be able to explain the mode of transmission, describe the pathophysiology of poliomyelitis, and also talk about their types, list the signs and symptoms, discuss the management, and list the complications of poliomyelitis. So now, let's now look at polio in detail. Polio, also called infantile paralysis, is a highly infectious viral disease which mainly affects young children, affecting the lower motor neuron of the spinal cord. It brings about paralysis that is characterized by fever, stiffness in the neck, and pain in the limbs. So poliomyelitis is caused by infection with member of the genus enterovirus known as poliovirus. Now let's define the condition. How can we now put the definition into perspective for poliomyelitis? We are saying it is an acute viral infection that is caused by poliovirus affecting the central nervous system and is characterized by fever, pain in the muscles, that is muscle ache, paralysis, and muscular atrophy. So that's the way we can define polio. Or in other words, we can still say it is the inflammation of the gray matter of the spinal cord and the brainstem and the cortex of the cerebrum. Okay? Cerebrum. Okay, so now let's talk about etiology. So poliomyelitis is caused by infection with a member of the genus enterovirus known as poliovirus. It is caused by poliovirus type 1, 2, and 3. So when we say type 1, 2, and 3, we are simply saying poliovirus type 1, which is brand-healthy, is the commonest. Okay, poliovirus type 1, brand-healthy, is the commonest. Then, the least common is poliovirus type 2, lancing. Okay, the least common is poliovirus type 2, lancing. Okay, so then poliovirus, which is second commonest, is type 3. Poliovirus, which is second commonest, is type 3, Lyon. Okay, so type 3 is Lyon. So it's BLL. So it's brand-healed, lancing, and Lyon. So those are the types, type 1, 2, and 3. Okay, the incubation period. The incubation period of polio is 14 days, but may be as long as 35 days. Although polio is essentially a disease of childhood, no age is exempt when you have an epidemic. Risk factors: under 5 age children but can affect anyone up to the age of 14. So mostly it may affect children or under 5 children, but we're saying can affect any age. So under 5 children, but can affect anyone up to the age of 14. Okay, people at risk include lack of immunization against polio and then exposure to polio. A child is lacking immunization against polio and then they end up being exposed to polio. Then they can catch the disease. All right, then other risk factors is travel to an area that has experienced a polio outbreak. Okay, if you travel to an area where there's been a polio outbreak, so children are likely to be affected. Then other instances where we see polio, so one of the risk factors is immunosuppressed. Okay, so now let's look at type of polio in terms of the parts or characteristics of the nerve parts that they are affecting. Okay, so we have bulbar poliomyelitis. This one is affecting the brainstem and is characterized by the presence of cranial nerve involvement. Soft palate, pharyngeal, and the laryngeal muscle poses a common paralyzed head and neck, bulbar. So when you're looking at the level types of polio, looking at the level affected, this one affects brain stem. And the brain stem is affected. All the areas that have been supplying the nervous innervation to these other areas below the brain stem, they cannot be innervated. Okay? So the connection here is just about nervous supply. So the nervous supply here of the cranial nerve involvement, that is to the soft palate, pharyngeal, laryngeal, okay, here they are paralyzed. Okay, so you have paralyzed head and neck. Then the location and anatomy of the bulbar region. Bulbar polio occurs when poliovirus invades and destroys nerves within the bulbar region in the brainstem. The bulbar region is a white matter pathway that connects the cerebral cortex to the brainstem. Okay? The destruction of these nerves weakens the muscle supplied by the cranial nerves, producing symptoms of encephalitis and causes difficulties in breathing, speaking, and swallowing, with the critical nerve affected being the glossopharyngeal nerve, which particularly controls swallowing and functions in the throat, tongue, and movement and taste. So the critical nerve here that is affected is the glossopharyngeal. Okay, that supply these areas for swallowing. The vagus nerve, which controls and sends signals to the heart, intestines, and lungs, and accessory nerves, which also control the neck movement, is also affected. Okay? The vagus nerve, which controls the vagus nerves, which controls signals to the heart, intestine, and the lungs, and the accessory nerves, okay, is also affected. Okay. Also, vagus nerves controls the upper neck of movement, so that's why there's some kind of paralyzed head. Okay, so now due to the effects on swallowing, the secretions and mucus may build up in the airway, causing suffocation. Other signs and symptoms include facial weakness, that is caused by destruction of the trigeminal and facial nerve, which innervates the cheeks, tear ducts, gums and muscles of the face, among other structures. We may see also difficulties in chewing and abnormal respiratory rates, depth and rhythm, which may lead to respiratory arrest. So we see difficulties in chewing and abnormal respiratory rate, depth and rhythm, which may lead to respiratory arrests. So there is also pulmonary edema, and this may lead to shock, and also this may prove to be fatal. The patient may complain of facial weakness, dysphagia, difficulties in chewing, inability to swallow or expel saliva, regurgitation of food through the nasal passage, and dyspnea. Okay? So I'll try to add some brain structures there so that you can see the types of poliomyelitis and the areas that they affect, that is the pons, cerebellum, medulla, and the spinal cord. So I would want you to see those structures and where they are found. Okay, types of poliomyelitis, that is type 2, the spinal type. This one is affecting the spinal cords. And if the spinal cord is affected, the patient will have paralyzed legs. The location of motor neurons in the anterior horn cells of the spinal column will be affected, and the patient ends up with paralyzed legs. Spinal polio is the most common form of paralytic polio and results from viral invasion of the motor neuron of the anterior horn cells or the ventral, that is flank gray matter, in the spinal column, which are responsible for the movement of muscles, including those in the trunk, limbs, and intercostal muscles. Okay? So this then destroys the motor neuron ganglia, causing Wallerian degeneration, leading to weakness of those muscles formerly innervated, and now these neurons end up dying. With the destruction of the nerve cells, muscles no longer receive signals from the brain or spinal cord. So without nerve stimulation, the muscles are going to atrophy, and they will become weak, floppy, and poorly controlled. And finally, patient may end up having paralysis, or completely end up being paralyzed. Okay, progression to maximum paralysis is rapid, that is 2 to 4 days, and is usually associated with fever and muscle pain. Deep tendon reflexes are usually absent or diminished. However, sensation in the paralyzed limb is not affected. Okay, so I said I'll add some diagrams so that you can be able to see the transmission there. So let's now look at bulbar spinal type. It is a combination of bulbar, polio, and spinal. Looking at types of polio in terms of the location of nerves that are affected. So bulbar spine type, which is the combination of above types, bulbar spine and polio, is also called respiratory polio. The virus affects most of the upper part of the cervical spinal cord, that is C3 through to C5, cervical, and number 3 names to about cervical level 5 names. And paralysis of the diaphragm is going to occur. Okay, the critical nerves affected are the phrenic nerves, which drive the diaphragm for inflation of the lungs, and those that drive the muscles needed for swallowing. This is in turn will affect your breathing, okay, making it difficult to breathe without support of a ventilator. It can lead to paralysis of the arms and legs and may affect swallowing and heart function. Okay, so that is what necessarily can happen there. Now let's look at mode of action. We're just looking at the types of polio